Hi, Diane Greco-Allen here, and today I'm going to do a little book review because I talked to a woman who was willing to share a lot of information about her story in relation to scleroderma. And she had some treatments done. They had put her on steroids, and she was on some other medication, and she had some reactions to the medication, and there was injectables that were involved, and she has been on antibiotics called pulse therapy for I'm not sure how many years. So she shared a book that she was reading about scleroderma, and it says that this is a proven therapy. And this is the Lancet reports that there's remissions with scleroderma using antibiotics. All right. So what's really interesting about this book and about what they did, they used minocycline was one of the medications that they were giving um, these different clients, or the study that was done. They also had been using methotrexate and penicillamine. And some of these doctors were, like I said, giving steroids to some of the people. But when I was reading over how they tailored the therapy, okay, what it said, it's just sort of, first of all, they said you have to have an accurate diagnosis. And a lot of people probably are not diagnosed with scleroderma, but they might be having high ANA titers, rheumatoid factor type titers, and also some IgG, IgM, or IgA, which are the immune responses to something, maybe an infection, an underlying infection. So some of these things, it says the ANA, diffuse scleroderma, is anti-RNA, and limited scleroderma and polymyositis is anti-PM. Okay, so here's the deal. Polymyositis is an inflammatory condition, okay? It sounds like there's something going on in the connective tissue, and it might be some kind of bacterial overgrowth that's made its way into the connective tissue. And sometimes these infections not only affect your connective tissues, but can affect your bones. And once it gets into the bone, when the bacterial infection takes over in your body, then it starts showing some other symptoms that might be related to cancers of the bone, bone marrow cancers, blood cancers and things like that, lymphoma cancers. So, when you're thinking about these type of autoimmune types of disorders, you have to think about what was going on in your life when you first started having these events. Is this something that started when you were under a lot of stress? Maybe you were in a relationship, you were eating horrifically, and there was a lot of stress in your life. And all these factors play a role in your wellness and how you're going to recover from this. And sometimes it might be pregnancy. So maybe that you don't want to be, you want to be aware of pregnancy and perinatal nutrition because it has such an influence on the progress and the stability of your pregnancy and what's going to happen afterwards, okay? All around that, even during your periods, before, during, and after. Okay, women have to go through these cyclic events more than men, so that's why they might be a little bit more intuitive about things. Also, they might be a little bit more irritable, maybe because if they're not getting the proper nutrients, maybe they're just, and some of this can lead to some, what I've noticed, and it happens with me too. You get OCD with learning about all this information, and then you become very OCD about your health. But it's because if you're dismissed for even having a condition or a disease or something's going on, maybe that's an underlying type of infection, and somebody says there's nothing wrong with you, you're going to be a little frustrated and start getting a little bit more um, you know, I would say self-advocate. You become your self-advocate and you stand up for what you know that there's something going on. Okay, so what I wanted to go over is that some of these doctors were deciding that what I really loved was that there was a mention in here. It says sometimes it's true and sometimes it's not. Okay. Early history of anti-inflammatories and antibiotics. For 2 examples, saw prescriptions written many times the dosage levels, which proved effective on the disease and even safe for the patient. They're saying it's safe, but more recent experience has seen the opposite. That's because down the road, after they started pounding them with all these treatments for anti-inflammatories and antibiotics, they found out that it threw the whole system way out of whack. And then down the road, you see, okay, this isn't working. What we did was we masked, we got the symptoms under control. Yeah, there might have been some containment of that disease manifestation from what they were looking for. But during that time, nobody addressed nutrition. There was no mention that we tried an anti-inflammatory diet. Okay, nothing, there's all kinds. So some other things I wanted to mention. So it said prednisone, which responsible physicians today dole out in 5 or 10 milligram tablets to help manage the discomfort or pain of inflammation, was initially described in doses as much as 80 or 100 times higher. So some of these people were put on these mega doses. Now, as a child, I had horrific cramps as a young girl. I was experiencing PMS for most of the month. Okay, but nobody told me that if I took out all those carbs, that maybe I wouldn't have as much pain, or maybe I wouldn't be bleeding so heavily and wearing diapers around as a child, at the age of 12. Nobody told us that, right? So and then it leads to these overgrowths of infections and viruses and our childhood diseases resurfacing in life, and those shingles going all over the crazy place. So it says, by the time a patient with connective tissue disease is no longer able to tolerate the therapy, okay, they're no longer, and which can happen very soon at those high levels. Yes, the prognosis is likely to be complicated by cataracts, weak, unhealthy cortisone skin, and kidney failure. Some of this is also related to diabetes. Okay, when you're talking liver damage, you're talking kidney damage, you're talking mind is going AWOL, and you're getting OCD, and you're starting to do all this stuff because we're addicted to sugar and starches and flour and the stuff that causes huge imbalances in the midgut. And then yeast overgrowth. And so there's also a mention of the Herxheimer's reaction, which I have in my book. It might be your pancreas. Yes, that's in there, because when you're treating, your body is automatically breaking down and going through cyclic events all month long, because you get rid of the old cells and then you recreate new cells, right? So some of these, they know that stem cell therapy triggers these new creations of cells, and they're hoping that they're better cells than what you got in your body. But it can cause, if it's too aggressive of a therapy for your nutritional, wherever you are, your stability, if you're unstable nutritionally with your blood sugar and with some imbalances in hormones, you're going to be all over the place. You are going to have all kinds of conditions. And I recently just posted that I have heard of people who have died from scleroderma because they didn't know how to manage it. Okay, now I am not against some of these antibiotic therapies. I actually believe that you could do antibiotic therapy like the pulse method maybe twice a year. Okay? Manage everything that you can with lifestyle balance, but if you need antibiotic therapy, then plan it. Have a plan. Not every dose is going to be the same for every single person, and we know that. You have to titrate the doses to that person's abilities. Okay, if somebody's already experiencing kidney damage and you're going to throw some things at them that they can't handle, they're going to go into renal failure. Okay, so why are we going to stress these organs more if you don't address the underlying problem, which probably is, now this woman that I talked to said that she was diagnosed a long time ago with celiac. She does not follow a celiac diet. And if you continue to give yourself gluten and wheat when you're allergic to it, your body is not going to handle it well. Most of this is related back to that triad of diabetes. It's the pancreas, the kidneys, and the liver and the kidneys, but also plays with your thyroid, plays with your pituitary and your hypothalamus, and the adrenals, and then your sex hormones that are down in your pelvis. Okay, thank goodness that woman did not have a complete hysterectomy like I did, and so that depleted me even more. Okay, there were no actual communications to go down to below, and may have reduced my abilities to produce these hormones. So there are some ways to do that, but I'm trying to do it with food. Some of these people have, that have had fibroids and who have had other hormonal issues in relation to the uterine wall and lining. These are conditions, and that's that connective tissue thing, because there's connective tissue holding that uterus in place. And if there's a virus or a bacteria that gets out into that connective tissue, okay, it's just going to spread if you do not support your immune system with nutrition. So that's what I'm talking about today. I hope that you'll read this book, only because it does have some information and insight. But I don't see anything in here that says that this study, if there was any mention that they took into account what these people were eating. Okay, so this has an antibiotic therapy method to treat these people with scleroderma, but we're not talking about what else is going on in their life and what kind of diets they were following or not following. The other thing that I learned was that a lot of people are afraid to eat more than one meal a day because they're too tired after they eat. They said they're wiped out after they eat, so they can't tolerate food. This is a major problem. And you have to go back to my videos and go through why it is important to maintain fuel and food throughout the day, all the colors of the spectrum of vegetation and fruits and vegetables, and then add in those proteins that we need. There's fats and proteins that are half of our brain and the myelin sheath only works if you support it with fat. And it's got to be the proper fats. And if you want to know what to eat, you're going to have to check out Dr. Mark Hyman's book, What the Heck Should I Eat? Okay? It's as simple as that. Just work on awareness of what you're putting in your mouth, 5 points of awareness, 5 W's, portion control, boundaries, Diane Greco-Allen, food relationship coach, and pain management for pancreatitis. Have a great day.